Hi, it's Dr. Stewart. I'm here at the office and I just finished up with one of my patients and thought, hey, I would really like to share his story and it's a really cool case with you today. So I've been seeing my dear patient for some time now and supporting his thyroid, hormone health, and some vague symptoms like urinary urgency. And he had been to many different specialists, urologists, you name it, and really wasn't getting traction. And even with me, I was, some of the things that I was recommending we weren't really getting the traction. So then I decided, okay, we got to dig deeper and figure out the root cause and what might we be missing here. We're doing a lot of gut work, and blood sugar control, and just not getting the results. And that's what actually, this is a really good point of, I appreciate it when someone's not getting the results to come back to me and say, hey, what else is there? Or where can we dig deeper? And so that way we can make sure that we find the root cause. And for this case, finally, we said, okay, let's go ahead and test your body burden of different toxins and chemicals. And thankfully we did, because quite a few things came up. And he didn't have an obvious exposure that was just kind of glaring, like, oh yeah, definitely we need to be aware of this and so forth. So this revealed, though, really high heavy metal levels, especially lead and mercury. And then this test, that's really pretty cool, also looks at other toxic chemicals that can be persistent or non-persistent in the environment. But things like parabens, things like pesticides, BPA, the herbicides, triglycerin, a lot of different volatile organic compounds. But anyway, this environmental toxin heavy metal test, one of them that I run is with Vibrant America. And the report's really nice, and it's easy to read, color coordinated, and you can see here, I blocked out his name here at the top, but some of the things that came up really high. So greater than 95th percentile here, so off the charts. And that was listed here. And then the nice thing that we can do is we can do before and afters. So this was the previous results over here, and then the current results are listed here. And with just a short amount of time with some treatments and a good liver support and detox, he decreased his numbers in half. And I'm so excited because I got to talk to him today. And so many of his symptoms have resolved. And we also did some blood work and noticing hormone levels, blood sugar, finally, liver, everything is improving. We still have a ways to go. And so we're going to do another round and retest. But I'm just so proud of him and also relieved that finally we're getting some answers, we're getting some traction. So if you feel like, hey, I don't know, I'm having these vague symptoms, things are kind of unexplainable, things aren't really quite making sense, and the traditional, whether it's allopathic or naturopathic treatments are just not working as well as we would hope them to be, then I really encourage you to dig deeper. Let's stay at this. Let's really get to the root here. And so I applaud for all of you for always, taking this seriously, because sometimes it's these stealth infections or hidden toxins that can make a really big impact on our health. So stay tuned, and I'm excited to share cases like this with you.